My name's Joe Pleasant. I'm 47 years old. I'm married. I have two wonderful teenage daughters. I live in San Diego, and I'm an attorney. And this is my story. It started back in 2012. I was at a high school football game, and I started noticing. I leaned over and I started noticing a little pain in my lower back. It was kind of weird. I didn't know why. Hadn't strained it or injured it or anything, but I just started getting this pain in my back, and that went on for a couple of weeks. Kind of came and went, kind of a weird achy pain. I didn't see a doctor. But next thing I noticed, I came home one day and I went up to my sink and I was washing my face, and I noticed under here, under my jaw, that two glands had swollen up. They were like about the size of grapes, and it was very strange. I pushed on them; they were sensitive, and I'm like, "Whoa, that's weird." Actually, kind of made me nervous because they swelled up on both sides. That had never happened to me before, and so I didn't tell anyone about it. I kind of hoped it would go away, after a couple of days, and they didn't. A couple of weeks, they were still there. So I decided to go in and see my doctor. So I go in and see my doctor, and he kind of looks at me, and he feels under here, and he can feel it. They're swollen. He says, "Yeah, they're definitely swollen, but typically when they swell up like that, that doesn't really feel like cancer to me. That feels like you have an infection, like maybe a virus or something. So we'll just kind of keep an eye on it. If you want me to do some blood tests," and I said, "Okay, do some blood tests." So they do some blood tests, and the blood tests, they come back normal. I have swollen glands, but I have normal blood, or normal blood tests anyway, for the tests that they ran. So it worried me and it concerned me because this didn't go away. Sensitivity under my jaw did not go away. It kept kind of throbbing and waxing and waning, and it went on for weeks and weeks and weeks, and it didn't go away. And I'm like, what is this? It's strange. It's kind of bugging me. And then one day I was sitting at my desk at work, and I was looking at my computer screen, and the cursor on my screen started moving in one direction a little bit. And I'm like, well, that's weird. Then I looked down, my finger was moving it, but I wasn't telling my finger to move it. It was moving involuntarily. So I started getting these weird neurological symptoms, like twitching and involuntary twitching in my muscles. And it was very, very unnerving because I never had anything like that before. My father actually had Parkinson's disease, which is a neurological disease, and people twitch with that in the early stages. And I started really freaking out, thinking, God, maybe I have Parkinson's disease. It's terrible. That's what my dad went through. He passed away, my late father. So that worried me, and that went on for a couple of weeks. I just kind of dealt with it. I didn't see any doctors. And then one day I was sitting at my desk, and this is when it really got scary. I was sitting there, and I was, my head felt pretty normal. It did. It felt normal, completely normal. 1 second, and then the next second, like wham, hit me like a ton of bricks. It felt like whew, all of a sudden I was dizzy. I felt doped up and loopy, like somebody had injected drugs into my system. It was the most bizarre thing in my life I've ever experienced. It just 1 second I was normal, 1 second I was not. I was on drugs, and it was that severe. It was very, very scary. So I started freaking out. Jumped on the internet. I'm trying to self-diagnose myself, and I came to the conclusion after doing my research at my desk that I had encephalitis, and that if I didn't get to an emergency room right away, I could die. So I'm freaking out. I'm actually crying while I'm driving, calling my wife. "I think I have encephalitis." I'm racing out to the emergency room. They get in there. I can barely even talk. I'm so upset. And I said, "Okay, calm down." They take me in. They do some blood tests. They do a brain scan. 3 hours later, they come back and they tell me, "Well, we have good news and we have bad news. The good news is you don't have encephalitis. The bad news is we don't know what's wrong with you." So it really didn't help me all that much at all. Other than they told me I didn't have encephalitis. Actually, I would have preferred encephalitis because you can treat that, and then it goes away. But in any event, I didn't have encephalitis, and they sent me home. So from that point on, for probably, I don't know, 6 months, 8 months, 9 months, whatever it was, I can't remember. I had this terrible brain fog and these weird neurological symptoms. It just kept waxing and waning, and they were just tormenting me. And it got to the point where it was very hard to even socialize, and I was miserable, and my back is hurting the whole time, and it's getting worse. And I'm taking pain pills just to cope every day with my back, and my brain fog is acting up, and it's hard to practice law. And life was just horrible, and nobody knew what was wrong with me. One day I went and I saw an ENT, an ear, nose, and throat doctor, to have him look at these glands again, have a specialist look, not just my regular doctor, the primary care physician doctor. And so, he looked at it and he kind of told me the same thing. He said, that doesn't really feel like cancer to me. He said, let me ask you, do you think you have any dental problems? And I said, no, not that I know. I don't have any pain. I don't have any abscesses. My dentist thinks my teeth are okay. I just kind of, she said, well, okay, that's typically what, causes that swelling, but again, it doesn't really feel like cancer, so I'm gonna send you home. So months and months and months go by. It was probably like a year and a half since my back started hurting until finally, I saw a back specialist. We tried physical therapy, didn't make the pain go away. And they did an X-ray and they looked at my spine and my back and they said, well, you have slight misalignment in the lower part of your back. We typically don't do surgery, but since you've tried painkillers and you want to take this for the rest of your life, and we've tried physical therapy and that didn't work, I'll get you authorized and we'll go in there. We'll do a fusion to fuse where the misalignment is. We'll unfuse it, give your nerve a little more space, and that should take care of the problem. So they approved me for surgery. It was in July of 2014, and the day before the surgery, they sent me in to have a pre-operation X-ray of my chest to make sure I'm not going to get pneumonia when they operate on me, so I can have general anesthesia and survive. So they do this X-ray, and I show up the next day, and they don't tell me they found anything unusual with my chest X-ray. They just go ahead and they do my fusion surgery. And so they do the surgery. I was in the hospital for about a week. Surgery went just fine. They didn't tell me anything was wrong. And then, so I go home, and I was still taking a few weeks off to recover before I went back to work. When I got a phone call, and they said, hey, Joe, are you having trouble breathing or swallowing? And I said, well, no, not really. They said, well, because your chest X-ray came back abnormal. We see something in your chest, and you need to come back and do some more testing. We need to do some scans and take a look at that. And I'm like, what? What's wrong with my chest? And he was very, I don't know, he used medical terms I didn't understand, physiology terms I didn't understand, trying to tell me there's just something off in my chest. And so anyway, I go back in, I get a full scan. Lo and behold, they discover that I have a baseball-sized tumor in my chest, a baseball-sized tumor in my chest. And they do further tests. They do a biopsy, and they comes back and they tell me that I have Hodgkin's lymphoma. And when they did the full body scan, it turns out I'm stage 4 Hodgkin's lymphoma because I have it all over my torso. I've got it in my stomach. I've got it in my bones. It's in my marrow. It's in my hip. It's in my tailbone. It's all over the place. My whole midsection was covered in cancer. Now, in my case, my cancer was very sneaky because they weren't able to diagnose it by examining me because it wasn't showing up in the usual places where you would typically be able to discover lymphoma, such as in the neck. Because again, the swelling in my jaw, that was not cancer. That didn't light up in the scan. That was something else. I'll get to that later. But it may be related. I don't know. It's just my theory. But this was not cancer. But it was certainly causing me suffering. But anyway, the cancer really started in my chest cavity. Everything was sneaky. They couldn't detect. They couldn't feel it in my armpits. They couldn't feel it in my neck because those lymph nodes were not swollen. It was all in the chest cavity, and that's why it was sneaky. Okay, my cancer was just very sneaky. And so I was very devastated when I heard the news that I had stage 4 cancer, since there is no stage 5. Stage 5 is death. I was stage 4. So I talked to my doctor, and he gave me a little bit of good news. He said, well, the good news is the type of cancer you have is treatable. The bad news is stage 4. So Hodgkin's lymphoma. It's pretty curable, treatable cancer. But the further along you are, the poorer the prognosis, the poorer the outcome. But we're going to get you treated, and I think you're going to be okay. So anyway, I go back to work, and I talk to my boss, and I give him the news. Super upset. I'm like crying while I'm telling him because I'm just so devastated. And he was stunned, but he says, Joe, what kind of cancer do you have? And I told him it was Hodgkin's lymphoma, and he said, wait a minute. You sure it's Hodgkin's lymphoma? I said, yes, it's Hodgkin's lymphoma. They did a biopsy. He said, Joe, my friend Todd works for a company that makes a drug that cures that. I said, really? He said, yes, it's a fantastic drug. I've looked at the materials and he's told me about it, and it's just a really good drug. Let's give him a call. So he makes a phone call and he gets Todd on the phone. And I'm on a conference call with Harlan and Todd, and we're telling Todd about my situation. And Todd says, well, Joe, I'm really sorry for your situation. I'm really sorry to hear that you have that. We do make a very, very good drug. I can send you more information on it. You can do your research. But the only thing is, it's very difficult to get at this point because it's only in clinical trials. And in fact, we don't even have a clinical trial in San Diego right now. We've got one in LA. But anyway, here's the information. If it's something you want to look into more, I'll see what I can do. So he sends me some information. He emails it to me, right? It's a PowerPoint presentation. And so when I go to see my oncologist down here in San Diego with my healthcare provider, he gives me the spiel. This is the standard treatment. It's ABVD. You're going to lose your hair. Last 6 months. It's probably going to be okay because what you have is Hodgkin's lymphoma. But there are some side effects, and it's not fun to go through, but you're going to be okay. And I tell him, hey, listen, have you heard of this new drug? It's called, it's some scientific name. It's brentuximab vedotin. Brentuximab vedotin, I think is what it was called, or Adcetris. And he said, I have heard of that drug, and that's a good drug. And you'd be the perfect candidate. The problem is, we don't have any clinical trials going on, but I do know a doctor over at UCSD that is going to be the doctor who's going to be doing that clinical study. Let me give her a call. That doctor was Aaron Reed at UCSD. So I leave. He makes some phone calls. I'm in contact with Todd. We're all making phone calls together to see if they can get this clinical trial up and running sooner than was planned in San Diego. And lo and behold, so I'm holding on. I'm kind of depending upon everybody to get it done. A couple of weeks later, they tell me, I can't remember who told me, somebody told me that, hey, listen, we're going to speed the program up. We're going to get it started early just for you. You're going to be the first patient in San Diego to get into this clinical trial. And we got your insurance approved you to be a transfer patient over to this other hospital. So you can do the clinical trial. So congratulations, you're in. You're in the clinical trial. That was awesome news because I really wanted this new drug. But at that point, it was still a 50-50 shot because it was the clinical trial. They're comparing it against traditional treatment versus sort of a new cocktail involving the new drug. And so I was really hoping and praying. I'm like, Todd, is there any way you can do something to make sure that I get this drug? And he's like, no, I don't have any play in that at all. There's nothing I can do. It's just kind of the computer randomizes people. If you get picked for the new drug, you get the new drug. And if you don't, you don't. It's just kind of the way it goes. So it's a coin toss. So I said, okay, it's a coin toss. Well, anyway, I check in at UCSD. They tell me about the drug. I sign all the release forms, and they say, okay, well, when we randomize you, we're going to tell you which drug you're going to get, which you're in the traditional group or the new drug group. And I said, okay, I really want the new drug group. And they said, well, the computer picks, we can't choose. So, okay, so I go home. That night, they call me up. They say, congratulations, Joe. I know you wanted the new drug. Guess what? You're getting the new drug. You're getting Adcetris. So I was like, yes. I was very happy. Did a high five to my wife over the couch. And so it was, I was very happy. I was very happy I was getting the new drug. And so, so I get into the program. And got into the program, and I started, so my plan was it was chemotherapy for 6 months, and I would get an infusion every 2 weeks. And the infusion was, again, it was Adcetris, ABVD, the new drug, plus, so it wasn't ABVD, it was A minus B, bleomycin, plus Adcetris, the new drug, and then the VD, the three other original drugs that go with ABVD. So they take out the B and they throw in the A. So anyway, I get this new drug cocktail, including Adcetris, and I start treating every 2 weeks. And in all honesty, the treatment was not. I didn't feel horrible. You see these movies about people chemotherapy and just throwing up and getting sick and looking like death walking. Just horribly suffering, people skinny. That was not my experience when I did chemotherapy. I didn't feel great a couple of days after I had the infusion, but I never threw up even once. I mean, they give you anti-nausea medication, and it wasn't bad. And so it was tolerable. And what they do is they test you at 2 months to see if the drug is working or not. So they did my test, they did a scan. And so remember, my scan at first was just horrible. I mean, again, I had a baseball-sized tumor here. I lit up like a Christmas tree in my whole stomach. It was in my bones. It was everywhere. I was just walking. I was just a walking cancer stick. But at 2 months, they did my scan. And you know what showed up as being cancerous? Nothing. Nothing lit up. In 2 months' time, I went from stage 4, close to death, to they can't even see it anymore in those scans. So that was fantastic news when I heard that. Um, so I continued with the treatment, and again, it was 6 months, and then my final infusion was on St. Patrick's Day, 2015, I believe. 2015, yeah. That was my final infusion day. I wore a little green thing, and they wished me well at the infusion center. And that was it. They did another scan, and again, no cancer, just like 2 months in. Um, and they would see me every quarterly. So they'd see me every 3 months, and I would go in and they would check my blood. And I didn't want to do a scan every 3 months because I didn't want the radiation, but I agreed to do it like once a year. So I kept going back as scheduled. It's been almost 2 years. And again, there's no sign of cancer. I did get a 1-year scan done, and no cancer was in that. I've had my blood looked at every single time I go in, and nothing unusual. So I'm feeling good, feeling healthy. I've got my life back. Thank you for inventing that drug, Adcetris. Saved my life.